The following portion of Bloom is sponsored by Tampa General Hospital.
Welcome back to Bloom. According to the CDC, every 4.5 minutes, a baby is born with a birth defect. While it can be scary for a new parent to hear about one of these conditions, advances in medicine continue to improve survival and quality of life. Joining me to discuss more on birth defects is Dr. Sarah Obican, Director of Maternal Fetal Medicine and Co-Director of USF Health and the TGH Fetal Care Center and Associate Professor of Obstetrics and Gynecology in the Division of Maternal Fetal Medicine at USF Health. Dr. Obican, welcome to Bloom.
Thank you so much for having me.
So what are some of the more common birth defects that you see?
Well, 3% of all pregnancies can have a birth defect, and 1/3 of those pregnancies are congenital heart defects. That's the most common, but you end up having things like neural tube defects where the spine hasn't closed, hypospadias, limb defects, cleft lip and palate. Those tend to be the most common ones.
Now, can some of these birth defects be prevented?
You know, we sometimes think we can't do anything about this, but that's not really true. If you take 400 micrograms of folic acid prior to pregnancy and in the beginning of the pregnancy, it really decreases the risk of birth defects significantly. Also, not taking alcohol or tobacco products, recreational drugs decreases that risk. And then taking care of our chronic conditions, diabetes specifically. When you have a high hemoglobin A1C with diabetes, you have a higher risk of these congenital defects. So managing that and medications, most of the medications are safe, but we want to talk to our healthcare provider to make sure.
Now, what advice would you give for families navigating a newly diagnosed birth defect in their child?
This is a tough time for families. You know, continued prenatal care, being part of a fetal care center where we can navigate some of these complex conditions, and then having support by genetic counseling for that pregnancy and future pregnancies, and then having support with family and other families that have gone through something like this in the past.
Now, TGH's Women's Institute has a fetal care center. How does that program support families that are dealing with this?
It's a great question. We do have a lot of psychological support for our families that are going through this, and then that subspecialty support to take care of these complex pregnancies and anomalies with either surgery prior to delivery or after the baby is born.
Yeah, because you don't realize what a weight it is on new parents, and
Yes.
they're not expecting this. You know, when you get pregnant, you think you're going to have a healthy baby, or at least you hope for one. So having this type of care must mean everything to families.
It's really helpful for that family in particular, but also for that care team to fully encompass that care for that patient.
And I'm glad you mentioned team, because that's what it is when you go to Tampa General Hospital, USF Health. You are dealing with a team of experts, so you're not running around from one person or one doctor's office to the next.
That's right.
It's all under one roof.
It is. All the subspecialties that we would need. We have great connections with all the community physicians to create that one kind of stop shop for those patients.
And whenever you have a research hospital, you're
Yes.
always on the cutting edge of treatment options.
Agree. I think academics is so important, and having kind of the newest technology available to patients and really to physicians who are caring for those patients is important.
Well, thank you so much for sharing this with our Bloom viewers.
Thank you so much for having me.
All right, for more information on Tampa General Hospital's Birth Defects and Fetal Care Center, visit tgh.org/women. Bloom will be right back.
The preceding portion of Bloom was sponsored by Tampa General Hospital.